This segment of DelmarvaLife is sponsored by TidalHealth.
It has been the subject of several inquiries over the last couple of weeks. This thing, my eye patch, and I've mentioned a couple of times that I wear it because of double vision. But I haven't really explained where that came from. It was a couple of weeks ago that I had a simple heart catheterization, but when I woke up, I wasn't seeing right, and doctors determined that I'd had a stroke, leaving me with double vision. Listen, God protected me, and I am grateful that it wasn't worse. So, this afternoon, I'd like to use my story to drive home to you the point that anybody can have a stroke. May is National Stroke Awareness Month, so we have asked our expert, Dr. Chris Snyder, Chief Quality Officer and Physician Advisor with TidalHealth, to come in and address stroke prevention and quality initiatives like statewide Stroke Smart. Good to see you.
Good seeing you.
Even with one eye, it's good to see
you.
you.
It's good to see you. Definitely good to see you. You had a busy 2 weeks.
It's been a couple of weeks.
Mm-hmm.
Let me ask you, how important is stroke awareness and what you're going to do about it?
So there's actually an initiative in the state of Maryland for educating the community, because we do a pretty good job. Once you hit our ER, our door to needle time, which is the treatment that we use for strokes,
right, is
pretty quick. But the problem in Northern Virginia, the NOVA system actually found out years ago that the pre-hospital time frame was so long that the stroke could not be reversed as quickly. So if I can get you into my ER,
right,
we can treat you and get you fixed much quicker than if you delay it. So the idea here is called Stroke Smart, which is a tool that actually our governor adopted a couple years ago. Our 3 counties in the Tidal, Maryland area,
right,
really are adopting that. We actually have proclamations being signed by the leaderships in all 3 counties, I believe today actually, but they will be signing those proclamations saying that we are going to educate our community on stroke awareness. And there's tools that the state has provided for free,
right,
through our Maryland Emergency Medical System services to ensure that folks understand what the early signs of stroke are.
And I was going to ask you, a proclamation is great.
Yeah.
But does it really get things moving to make a difference to the potential patient?
Yeah, and actually in Northern Virginia, when they did the early studies with the Stroke Smart education, you know who did best? The middle school kids. So really? Showing them and teaching them how to recognize a stroke, they did better than the adults did, which is not a surprise. So, but anyways, and they're looking for this rule. It's called Be Fast, which means get them to the ER quickly.
Right.
But Be Fast actually allows you to identify the stroke with slurred speech,
right,
okay, and weakness on one side or the other. We don't want you to sit there and look at them and try to figure out what's going on. We want you to call 911.
Right.
So we want to get the experts to you so you can get to us.
So Be Fast is an acronym.
Absolutely, 100%.
And it means?
Well, be fast, just be fast.
Right.
Get folks fast to the ER. So be fast at recognizing stroke and calling 911. So we want you to do it quickly. We don't want people to wait. Shortening that time frame, because I got about 4 hours to do the clot busting drug, and I got about 24 hours to do an intervention. Dr. Shakur runs a catheter up into your brain and can pull the clot out, preventing further neurologic problems. So it's important. Time is brain.
And time is brain. I'm glad you said that. Time is brain. And education of the public is incredibly important.
Well, you have to be able to recognize, and again, if you're going to shorten that time frame for me to get that medication in you, I have to have you in the emergency room. So
right,
looking for weakness on one side. So the kids at the bus stop and with grandma, and grandma starts having weakness and slurred speech. Boom, 911, let's get them there. And actually the process of calling 911 is simple, but you have to think why you're calling, and that's what we're trying to identify. So we'll be out in the schools, we'll be in the health departments, we'll be in the businesses, we'll be in the churches talking to people about this. And each county is going to consume that and make that a moving forward effort. And what a great month start, Stroke Month.
Okay, all this sounds wonderful in response to a stroke.
Yes.
What would you tell us about what we can do to try to prevent one?
So preventing strokes, it's cardiovascular disease. Unfortunately, there are some risk factors with it. Cardiac disease is probably number one, any kind of intervention. But we put folks on aspirin, so seeing your provider, keeping up with exercise, weight loss, weight control, all those things that prevent any cardiovascular disease, because a stroke is a brain attack. Okay? You have a heart attack, which is lack of blood flow to the heart. Same thing happens to the brain. So anything you can do to keep those blood vessels open. So diabetics are higher risk, people with previous cardiac history. So again, making sure you're following up with your doc, getting on aspirin products, good blood pressure control. Don't smoke, don't drink, all those things we tell you not to do.
Just work hard to be healthy.
Absolutely.
Because this is not fun.
No.
No, so don't do it. Dr. Chris Snyder with Tidal Health cannot tell you how much we appreciate when you come in and talk to us.
Sure. Great talking to you.